For most people, the ability to see and hear the world clearly can be easily taken for granted. The eyes and the ears are a highly specialized sensitive sense organ which are subject to various disorder. Therefore, we should take care of our ears and eyes to ensure proper functioning.
Upon assessment, the nurse will obtain health history, provide a calm and relaxing environment, and establish rapport. Ask for pertinent data and explain the procedure. Accompany the client to assessment room. Wash your hands to deter the spread of infection. Distance vision. Using the Snellen's chart, have the patient sit or stand at about 20 inches or 6.1 meters from the chart. Then, ask the patient to cover her left eye with an opaque object. Then to read the letters on one line of the chart and to move downward to increasingly smaller lines until she can no longer discern all of the letters. Have the patient repeat the test covering her right eye. Then, record the vision with or without correction. Here are the normal findings.
Confrontation test. Testing peripheral vision. Sit or stand directly across the patient. Then place your hand 2 inches apart on either side of the patient's head. Then gradually bring your wiggling fingers into his visual field.
Inspecting the eyes. The eyes should be 1/3 of the way down to the face and about 1 eye's width apart from each other.
Conjunctiva and sclera. Ask the patient to look up and gently pull the lower eyelid down to inspect the bulbar conjunctiva, then have the patient look down and lift the upper lid to examine the palpebra conjunctiva. Test corneal reflex using wisp of cotton. The normal response is a blink reflex.
Accommodation test as shown. The normal response is that the eyes should converge and the pupils should constrict.
Testing the pupils. First, explain the procedure to the client. It is to test the pupils for direct response and consensual response. This is a pen light. First, you have to slightly darken the room and then shine the pen light about 20 inches. And note for normal response, perla, pupil equal round, reactive to light, and accommodation. Cardinal positions of gaze. Cardinal positions of gaze is used to evaluate the oculomotor, trigeminal, abducens, and extraocular muscles. In doing so, ask the patient to remain still while you hold the pencil at about 18 inches or 45 centimeters directly from his nose and ask her to follow the objects without moving his head and move to each of the 6 cardinal positions. Examining intraocular structures. Before beginning your examination, ask the patient to remove her contact lenses or eyeglasses. This is the ophthalmoscope. It allows you to directly observe the client's internal eye structures. Then, slightly darken the room to dilate the pupils. Then, hold the ophthalmoscope at about 4 inches or 10 centimeters from the patient's eye. Adjust the lens so you can focus on the anterior chamber. Look for clouding, foreign matter, or opacities. Inspection and palpation of the ears. First, explain the procedure to the client to gain trust and cooperation and to alleviate anxiety.
External observation of the ears. The top of the ear should line up with the outer corner of the eye, and the ears should look symmetrical with an angle of attachment of no more than 10 degrees. Inspect the auricle for lesions, drainage, nodules, or redness, and then pull the helix back and note if it's tender. Inspect and palpate the mastoid area behind each auricle and note for tenderness, redness, or warmth. And finally, inspect the opening of the ear canal, noting for discharge, redness, odor, or the presence of nodules or cysts.
For the otoscopic examination. This is the otoscope. The otoscope allows you to directly observe the ear's internal structures. Ask the patient to sit with his back straight and head tilted away from you. Straighten the ear canal by grasping the auricle and pulling it up and back. Hearing acuity test. Test the patient's hearing using Weber's test and Rhine test. This is a tuning fork. It is used to evaluate bone conduction in Weber's test and used to compare air conduction of sound with bone conduction of sound in Rhine test. For the Weber's test, strike the tuning fork lightly against your hand or on any hard surface. Then place the vibrating fork on the patient's forehead at the midline or on the top of his head. Then for the Rhine test, place the vibrating fork over the patient's mastoid process and ask the patient to tell you when the tone stops.
As the coat steers, the eyes are the windows to our souls.
So if you love them, you're gonna take care of them.
So here are a few reminders on how do we take care of our eyes and our ears. Let's begin with our eyes. First is that you have to take a lot of fruits and vegetables, especially carrots, because carrots are loaded with beta-carotene, and beta-carotene are helpful in maintaining healthy eyes. Not only that, these carrots are also powerful antioxidants, thus they prevent macular degeneration. Next is that it is recommended that we avoid wearing contact lenses for more than 19 hours. Not only that it causes permanent sight damage, it also causes extreme discomfort to the eyes. And lastly, you have to wear UV protected sunglasses. So get the polarized sunglasses, not just the darker ones. Now, Ruel, what are your recommendations on how to take care of our ears?
Yes, Late. Now these are the know-how to protect your ears. First is avoid blows to the outer ear. If you are participating in contact sports such as wrestling, boxing, and rugby, be sure to wear head protectors, headgears, which includes protection to the ears. Secondly is that lower the volume down. If you use televisions, personal stereos, make sure not to use them very loud, especially if using headphones or earbuds. And lastly is that if you see that there's something wrong about your ears, then consult your doctor. Ear infection can damage the drums and the bones of the middle ear, causing hearing loss. I'm Ruel,
And I'm Lady.
and in behalf of Group B, we would like to leave you a lesson for this day. Take care of your eyes and ears.
That would be all. Thank you.
Layo pa! Tian, hoy, tian!
Chika, nagyapon pa dayon. Sunod pa sila sa things pero kay nala dahil.
Ana, maglisod kag sakat kan, di ba? Ana na, ang nurse na lang ang musulod.
Nari love gown. Gusto ko mag-love gown. Siya!
Aba, aba, aba.